So this is a very important matter to be discussed, especially there are a lot of females having breast cancer. So why oncologists recommend yoga for cancer, and what exactly yoga does for prevention and during and also after the chemotherapy. So how yoga can be beneficial. These are the things I will be explaining, and I think tomorrow Dr. Susovina, oncologist, she will be explaining about the cause, signs, symptoms and more details about the problem as such as the cancer. Okay, so I will be going through the actually a little bit of survey they have conducted in 2020. So in this survey they have found that 2.3 million cases are happening with the female breast cancer, and second goes the lung cancer and then the liver cancer. So most commonly found cancer is female breast cancer. No matter what the cancer is, but on yoga all the cancer, almost everything is same when it comes to the exercise part, and how it is beneficial for the human being is all the same. So let us discuss one by one about the why it is happening for some people. So that is very important, isn't it? Like why it is happening for one section of people, because everyone's body is having cancer cells, and when the cancer cell it's becoming little bit over exceed its limit, then it becomes threat for their own life. But believe that there are cancer cells in your body, but there are two favorable condition that you are putting in your body that increases the number of cancer cells. Can you guess what it is? There are two favorable conditions. I don't mind like if anyone unmute themselves and they can interact with me. There are two very important favorable conditions. Can you name it? That why cancer cells are increasing in our body? Very important.
Maybe one of these factors.
Yeah?
And smoking.
Smoking, alcohol, these are the risk factors. Yeah. But I will explain it. Sugar, yeah. These are all actually coming as the risk factors, but the diet, so you can call it from the diet itself. These are all right, but I will call the diet is very important, because food shall be the medicine and medicine shall be the food. You have heard about that quote. And food is the first important thing which is giving the favorable condition for the cancer cells. The second thing is your mind. So there is another quote goes like this: when the mind strive, the cancer survive. I will go once again. When the mind strive, the cancer survive. So when your mind is in like an angry suppression, all that emotion, then the cancer can survive better. And there is one survey conducted, and it is very interesting for me, because this survey is conducted completely on the emotional aspect of the cancer. And there were two groups. In that one group, they were given yoga and relaxation technique, and the other group were not given any kind of exercises. So they could see the difference in both of the group. But when they took the case history of the same like two groups, the non-yogic group and the yogi group, they could see the people who are doing yoga, they are actually expressing better than the other group. And another survey they have conducted, and they were asking the case history. Then when they were going through the case history of the people, do you know there was one very important factor which shocked and surprised everyone among the oncologists was the people, 90% of the people who have got the cancer is having a problem called as suppression of their emotions. Okay, when they suppress and they don't express, the people who are very and we usually say that person, he don't deserve a cancer because he's very gentle and he's very good in his diet, and he used to do exercises really well, and then also how can he get the cancer? Maybe because of his polite nature, or she's very polite and she suppresses all her emotions, and she gets from the society and she's not expressing it. her emotions like anger, frustration. She have to express it, and because of this suppression, then the cancer survive inside her. This is very important point to be noted, because we are coming to the end with the solution of it, because for the stress and anxiety is one of the main cause of cancer. So that will be, we will deal with the solution at the end of the session. And the first thing, diet. Let me tell very brief about few food items. If you want to scribble it somewhere, you can write it down. I have pointed out few food items like this is really good to prevent cancer and during cancer and after the chemotherapy treatments. So here you go. The first thing is a vegetarian diet. I will go little bit fast. Ginger and turmeric. If you are drinking ginger and turmeric tea every day, you can prevent many things, not only cancer, it improves the immunity, etc. and etc. Fennel seeds. Fennel seeds are one of the most important factor which increases the happy hormones in you, especially for the females, as well as it is having antibacterial, and even it is very gentle on your stomach. So have you seen in hotels and restaurants you have fennel seeds in their at the reception? So you have it because it increases the digestion. So digestion is very important, as it is having a little bit connection to the cancer cells again. And then saffron. Saffron is very important. All the berries, blueberry, blackberry, all the berries. Salmon, out of the fishes, you can choose salmon is one of the best. Sweet potatoes instead of potatoes. So swap your potatoes with the sweet potatoes. Then pomegranates. Pomegranates are the best for fighting against cancer. Mushrooms. Then vitamin D exposure. Vitamin D capsule you can take once in 3-4 days. You can take 5000 IU unit. You can take vitamin D, so that you are if you feel that you are lacking vitamin D in your body, you can do that. You can take the capsule. And you have to prepare everything in coconut oil. Coconut oil also, the oil, when they were having a survey again about the preparation methods or the cooking methods, the people who are having outside food, restaurant foods, fast foods, they are having more of colon cancer. And why? Because of the repeated usage of oils. So if you are preparing the coconut oil and fried in your house, you can get good digestion, and it will, again, coconut oil is having a property called as, it is antimicrobial and antibacterial. So this also can eradicate all the bacteria, and it can cleanse your system. And what all things you have to avoid, like one of the client here, she mentioned about the alcohol or smoking, I heard like that. So these are these are also the risk factors. What all things you have to avoid? Alcohol, smoking, fatty and fried foods, and red meat. If you are taking all these out, you can be like, you are safe actually. And all the white products like white flour and sugar, all the white things are good in appearance but not for our body. So this is in short about the diet, what I prescribe or I suggest for the people who comes to me. And the second very important thing is stress and anxiety, that we will be dealing breathing exercise and deep relaxation at the end of the session. Another thing, and I already mentioned about the mind strive. When the mind strive, the cancer survive. So ladies out here, if you are involving any recreational activities like painting, drawing, gardening, and you are having the food on time, these are very important thing. You may think that, but this can be some of the risk factors for cancer. It cannot be the direct reason for a cancer, but it will all add on to the problem. Okay, and also the sleep. Sleep on time is very important. Including me, I have to follow that. I should not sleep late. I have to be early on my bed, and I should be early to rise. So this all we have to keep in mind to have a better life, and we can prevent cancer from many outside sources. And what all things we can do, I'll be explaining how to prevent it, I will be telling. But there are two things that you cannot do anything about it. There are two risk factors for everyone to get the cancer. That is, one is getting older. Getting older, the more risk for cancer. We cannot stop that one particular fact that we cannot be young. So every year we get older. And then the second one, the DNA what we inherited from our parents, we cannot prevent it. These are the two things that we cannot prevent the cancer. And female breast cancer, as I already mentioned, this is the most commonly found cancer in the world. So I will be focusing more of breast cancer prevention methods, and already I had an exposure with Dr. Susovna in one stage. So she was mentioning about the oxygenation to the cells. So she will be explaining in detail tomorrow. So I'm not touching that part. Let her explain. So I was thinking, like, if tomorrow, if you are attending her session, you will understand why these particular exercises are good for that. So she will tell you, maybe she will tell you some stories, personal stories or experience that she was having with the breast cancer. And when one of her patient was undergoing through the chemo, she was explaining that one person, she got out from the chemotherapy effects faster, or she didn't go to the stage 2, whereas another person, she got again the stage 2. Why there was a difference? Means the first person was doing exercises and the second person was idle. So I made it short. She will tell you the story in detail. But so just see that when you are even having the chemotherapy, you should always see to that you are exercising a bit. You should not be idle in your bed, because your each and every cells in your body need oxygen to heal yourself. So oxygen is one of the key to the healing. So keep in mind that breathing exercises, walking in the fresh air, taking more of oxygen, exposing to the vitamin D, and having good food, vegetarian diet, and the diet what I have suggested you. If you are doing all this, you can surely come out from the chemotherapy, or you will not go to the second stage of cancer, and you can prevent it from the beginning itself. So this, what all I am telling you, this can be a preventive method, as well as those who are going through the problem also can be benefited, and also after, you don't want that thing to come again in your life. So let us begin our first method, first demonstration, that is nothing but the exercises for your upper body. So all of you, I don't like to talk about the theory part much, because I'm always a practical person and I always love to demonstrate. So let us go for the first exercise, that is shoulder shrugs. So all of you, make your spine straight, go for the shoulder shrugs, and feel that when you are doing this, you are actually expanding your chest, isn't it? And when you go back, you can feel all your shoulder muscles, and then you can slowly take your elbows up like this and go for a full arm rotation. The people who have gone, they are undergoing this breast cancer, they will understand the benefit of this particular position, because it improves the oxygen in your breast tissue and all the cells here. So this is actually every day you have to do this. Okay. Now the next one, you can just go for the wrist joint and fingers. Go for the side neck stretches. These are good actually for the screen. The people who are always with the screen, this is very good to strengthen your neck and head. And up and down. When you do this, try to inhale when you look up and exhale when you look down. Now you have to hug yourself, and you are crossing your hands like this, and then you hunch a bit and stay like that. 1, 2, 3, 4, and 5. Open your hands out, and then just take your elbow a little bit back, open up your chest, inhale, and you exhale, hunch again. You can cross your hands in front of you now. Again, inhale this is very good for the people who are having the treatment right now. Okay, it will increase your oxygen levels. Exhale down, inhale, wide open. Okay, and then exhale and close. The other postures, I will be going to my yoga mat and I will be demonstrating. I was just taking you taking a break between my theory. One more very important factor I wanted to tell you is why physical exercises, why we need to sweat. I will tell you one more very important matter is your fat cells. So when the ladies attain their menopause, they are having more risk of cancer. Why? The fat cells produce estrogen. The more the fat cells, the more the estrogen in your bloodstream, and it is having a vice versa connection as well. The more estrogen, again they produce the more fat cells. That's why when the lady hit menopause, she is having more prone, she is more risky for cancer. And the people who are having all this uterus cancer, they are having more fat cells. So if you just do a survey, the people, the youngsters here, when you check the cancer patients, you can see more the fat people are getting the ovarian, uterus and the breast cancer because of the more fat cells in their system. Okay, so this is also one of the very important thing. And one question I encounter from the cancer patient is how much intensity I need to do yoga. For example, should I do it mild or moderate or high intensity exercises prescribed for cancer patients? So for them, prevention, you have to go for high intensity. So schedule yourself. In a week, you can go for 3 days of high intensity exercise, anything that makes you sweat. It can be a dance, it can be yoga, a power yoga, it can be Zumba, aerobics, whatever it is. It should make you sweat. Being a yoga therapist, I don't recommend only yoga. I recommend all the exercise forms in this world is good for you. So, it should make you sweat. That's all. And the second thing, you can go for brisk walking, because when you're exposed to the environment, the more of oxygen, the fresh air gives a lot of healing for you. So that is very important. So 2 days for walking, 3 days of high intensity exercise that makes you sweat. And the third one is you can go for some recreational activity, as I already mentioned, like gardening or painting, whatever you love. So self-treat yourself. So make your mind happy. What is your passion? Go and do it. So you have to keep 1 day for it. If you are, many times I have heard from teenagers and also from the young ladies, they always tell that, Akhila, these days I don't have time because I got into a work, I don't have time to paint. And I used to love painting, but I forgot to dance because I was a dancer, but these days I'm not finding time. But out of this 24 hours and 24 into 7 days, can you find 1 hour for yourself? That self-me time of your, so that 1 hour is very, very important for your emotional health. So find time for that. So now I told you about the sweating, high intensity. Second one is exposure with the environment, and the third one is the recreational activity or the passion you have to follow too. So here you are actually, if you really go deep into that schedule, you will understand you are actually satisfying your physical health, you are satisfying your mental health, and you are satisfying your emotional health. So these 3 factors are very important for cancer not to survive in your system. Hope it's very clear. Now let's get into the step-by-step demonstration, and then I'll be giving you a very short idea about the yoga postures, and then we will be going to the breathing, and then we will be finishing with the deep relaxation. Hope it's not boring. Okay, so now let's get into our first one, yoga demonstration. So if you, Anisha or Bipasha, if you want to spotlight my window, you can do that so everyone can see my body posture very clearly. My mat is visible, isn't it? Okay. Come to the foreleg position, or you can write the first posture of the day is cat and camel pose. So come to the foreleg position and you drop your spine down and head down. Just stay there for some time and then tuck in your tummy, go high to a camel and then exhale to a cat. Bend into your elbows and come down. Again, inhale, go high, exhale, cat. Once again, inhale and exhale, down. And then come back, stretch your hands really well and keep your head down. Now, there is one very important posture for the people who are having the cancer. They can do this. They can just put their fingers like this, like as if you are like a crab, okay? Like how the crab looks like. And then stay there. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And then look up, stretch your neck, and then come back step by step. And then from this position, you slowly get into the Vajrasana. This sitting on your heels is nothing but the Vajrasana. And then you stretch your body really well. Look at the backwards in your eyes and stay there. 1, 2, 3, 4, and 5. Exhale out. You can go for 10 seconds. 1, 2, 3, 4, and 5. Exhale out. Second time of practice. 1, 2, 3, 4, and 5. One more time to go. 1, 2, 3, 4, and 5. Now, slowly try to interlace your fingers at the back like this. You can interlace your fingers. This is very, very, very important to increase the oxygen levels to your system. And then you can look up and relax. 1. If it's not reaching, don't worry. You can just keep it like this. Your hands just like that, okay? And you can even use a belt to reach hand to hand. And stay there. You can see the shifting of your ribs to up and down. And you close your eyes and stay there for a while. 5, 4, 3, 2, and 1. Slowly stretch your hands and go for the other side. Your one side will be very easy. Don't think that it's abnormal. And the other side will be little difficult. So you can go for the other side. Stretch your back really well. 1, 2, 3, 4, and 5. Now I have selected few postures. Actually, this is not only for the breast cancer. This will increase the blood circulation to all over your body. So if you do these exercises, specially designed exercises, you can actually prevent many cancer before it invades you. You can prevent it, okay? And the next posture, you can stretch your legs and then keep your spine straight. Flex your one leg. I will make it very easy. And then hug your leg. That means this is my right leg. I am holding my left hand to my right leg and then keeping your other hand at the back, Vakrasana. You don't have to remember the name. You can just write like a twisting posture by holding your opposite hand to your knees. And stay there. 1, 2, 3, 4, and 5. You can, when you do it yourself, please go for 10 to 15 seconds. Go for the other side, hold it. 1, 2, 3, 4, and 5. Slowly come back. So these many exercises, actually this is good for all the cancer that is happening from your stomach till your thyroids, even your throat cancer, breast cancer, stomach cancer. These all exercises are very good for them. Now the things what I am going to show towards the lower part of the body, all those organs will be included in that. So that makes it easy for you to understand it. Now let's go for the butterfly or the Bhadrasana. Butterfly position, you have to just sit in this position, keeping your spine straight, holding your hands to the feet, and just stay there. This is very good to remove all the problems of the uterus. Okay, and then if possible, try to come down and touch your head to the toe. So practice it every day so that it will be easy for you. And then slowly stretch your legs again. And then I'm slowly taking you to the fish pose, easy fish pose, not a complicated one. You are going to take your elbow support and then you can touch the center of the head to the floor. And your body looks like a fish. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Release your head down and then slowly take your legs to the 90 degree. When you raise your legs, actually a lot of blood is coming towards your head, and this is very, very important to improve the blood circulation towards your upper body. So this will release all the stress, anxiety, and many other mental ailments. And from this one, slowly take your leg to the Pavan Muktasana and slowly hugging your knees to the chest. Stay there for some time to improve the digestion. So for the stomach problems, you can get rid of all your stomach ailments with the Pavan Muktasana, and slowly with the help of your hands, catching hold of it, try to touch your head to knees and stay there for a few seconds. And then you inhale and come back. You can release your tension of your back by doing a lumbar twist to the either side. This is not included in that, but this is just to ease yourself. And the last posture in this series is the bridge pose or the Sedu Bandhasana. You are keeping your feet down, hands beside your body. Raise your hip up, stomach up, chest up. And those who want to go for the second level of practice, they can bring their feet and they can push their hip pelvis a little more up. Make a good curvature for your spine and stay there for 5 seconds. 3, 2, and 1. Slowly bring your body step by step down, and then you can lie down in a butterfly position, that is an open diamond position, and keep your hands at the back of your neck, closing your eyes and relax. So this is a set of exercise that can deal with many problems of your uterus, as well as the breast cancer, and also the problem with the stomach. You can easily tackle through this set of exercises. Now coming to the breathing exercise. So you can sit in any comfortable position, in a chair, I don't mind. And then your left hand is holding in this chin mudra. If possible, try to put your left hand on your lap like this. And your right hand, this is called as Nasika mudra. I don't know whether it's clear for you. The second and third finger is folded and all other fingers are up. Or if it's difficult for you guys, just take your 2 fingers and do this. That's all. So start from your left. Start from the left. Inhale, close it. Exhale through the right. Inhale through the right. out through the left. In through the left, out through the right, in through the right, out through the left. So this is one cycle. You can repeat it the same breathing exercise for 3 times. This will instantly calm your brain, and it will balance your brain, and it will give you good coordination. So this is very, very important during the crisis. The second breathing exercise is called as Bhramari, or the humming bee sound. So you can close your index finger, inhale and exhale as humming. After 3 times of practice, keep your hands down. You can feel that your brain cells are already opened up and you are feeling so relaxed. Take some deep breathing in and out. As you inhale, feel that you are becoming taller towards the ceiling. As you exhale, feel that you are coming down and your tailbone is hitting the floor. Inhale. Lengthen your spine. Exhale. Bring it down. Inhale. Feel the spine is moving up. Exhale. Relax and go down. One more time to go. Inhale. The spine is moving up. Exhale, it goes down. And slowly open your eyes. Now there is one more important exercise. One of the rehabilitation center I have seen how they do is, the people who are having the chemotherapy, for them actually this you can tell it to your family or the friends who are having chemotherapy right now. You can just tell them to extend their hands like this and stretch their spine, and then take it back. Exhale. Inhale, stretch their hands out, make your spine straight. Exhale and bring their hands back closer to the hips. One more time. Inhale, stretch their hands out, the knee. And you exhale and bring it back. Another chemotherapy exercise is keeping your hands here. Slowly take your hands up. Inhale, stretch, and don't bend too much to the side. Just give a light push for your ribs and feel that beautiful stretch happening at the side of your body. And you exhale and bring it back to the mat. Very good. Go for the other side, stretch. You can feel the opening of your ribs here as you exhale and come back. Like this you can do for 6 times in total. And now you hunch and tuck in your tummy in and look down, and then you push your chest. Slowly lengthen your spine up and look up. Stretch your neck and feel the beautiful stretch of your spine, and again tuck in, go in, see the shrug of your stomach. As you come back, you can inhale and look up. Exhale and come down. Inhale, look up. Exhale, come down. If your doctor is agreeing for some exercise, especially after your breast cancer, breast removal, and you are having a or you are having a chemotherapy, you can do certain exercises like very gently. You can go for the shoulder because there will be lymph edema that she will be explaining tomorrow. There will be fluid retention. So if the doctor is giving you a consent that you can do that, then go for this exercise. You can slowly go for the rotation of your shoulder like this, because there will be a lot of fluid accumulated around your breast tissue after the removal. You can go for this and then keep it back, and then slowly, because the patient will not be able to do it together because it will be very painful for them. So you can very gently, they can do this, and then slowly tell them to massage their hands in this way, and then from the other side you can just give a gentle massage. They can even slowly go for this pushing or grabbing their muscles like this, and in this side also. So this all will help them to release all that pain and side effects from the operation. Okay, so these are few things you have to keep in mind. I have mentioned about the prevention, then I have come to the breathing and the person who is going through the crisis, and also after the chemotherapy, how you can heal yourself step by step. Now one more exercise in the standing that is very important to open up, and this is actually a prevention method that we can go for, and we will finish the demonstration part. Here you go with the triangle posture. So triangle is like an all-rounder, so you can split your leg. This is my left side, so I am turning my left feet to the left side. Even this is indicated for the men who are going through the prostate cancer and also the liver cancer. This is very indicated for them. Triangle posture. And then you can take your one hand up and look at the thumb if possible. If you are feeling giddiness, you can look straight and stay there for 5, 4, 3, 2, and 1. Slowly come back. I'm reducing the duration because of the, if we do, it will be more than 1 hour. But you can do you can go for 10 seconds. So look at the other hand now. 1, 2, 3, 4, and 5. Slowly keep your hands down and come back. Now the second posture is the side lunge. You don't have to incline your legs too much. You can keep it to the 90 degree with the knee, with the feet, and just stretch. Open your chest out, open your hands, and just be with the nature and have that acceptance. Okay, so feel that your body is opened up and the nature is accepting you. And feel the connection between your body and mind, and stay 3, 2, and 1. Slowly exhale and come back. This is like general exercises to prevent any forms of cancer or any ailments. So first you come to this position, open up and go a little more back, and then be proud, your face is a little bit up, and inhale the nature and exhale all the stress. 3, 2, and 1. Slowly exhale up. The last posture, it's called as a Virabhadrasana. Here you bend it to your knees. This is again indicated for the prevention of breast cancer, all that here, liver, pancreas, everything. Stretch. Either you can go for a sky pose, or you can join your hands at the back of your head and go for a Virabhadrasana. Warrior pose. 2, 3, 4, and 5. Exhale and come back. And then turn your feet, go to the other side. Stretch, stretch and stretch. I like to join my hands at the back. 5, 4, 3, 2 and 1. Slowly exhale and come down. Touch the hands down and keep your head down and relax. Stretch your calf muscles and relax. 1, 2, 3, 4 and 5. Slowly you can jump back or you can come step by step to a toe sitting position to balance yourself. So this is how you balance your body, balance your mind. Sometimes when you imbalance, it's not the problem with your weight, nor the problem with your muscles or joints, it's your mind. So if you are able to balance and balance your mind, you will be able to balance your body. And then if you can, those who can just try closing your eyes, whether I can balance my mind or not. And just stay there and then slowly come back. So these are a few demonstrations I have designed for you guys so that you know what all things we can prevent generally and what all things you can do for the crisis time and what all things after the chemotherapy, because the chemotherapy patients will be undergoing a lot of side effects. So be careful, with the lymphedema. So that is one problem always oncologist says. So always ask the doctor consent before you start yoga. And I think I have covered almost everything, and we will go for the last summarizing part. So why now you will be knowing that why yoga is important for the breast cancer or any other cancer form. It improves the quality of life and also it reduces the fatigue. This is very important. This will remove the tiredness what the patient is undergoing. So because of these two reasons, yoga is very, very beneficial. To summarize it all, I will like to give you stop binge eating. That first thing. Stop binge eating. The more you eat, I forgot to give you one more thing about the eating mentioned in the first one. Two favorable situation, you remember in the beginning we have mentioned that. So this, when you eat more, what happens is you are keep on loading your intestine and stomach with a lot of food. So what happens, the cancer cells can survive in that and cancer cells can grow because you are giving an inflammatory condition inside your stomach. So when your body is inflamed, there is more chances of not only cancer, any diseases can come. And the people who are having arthritis, all that issues, if you see, this is called as an inflammatory condition. So you have to go for intermittent fasting. So to prevent cancer, at least, for example, intermittent fasting is like 13 to 14 hours of fast. So you have to eat early dinner and you have to eat late breakfast. So you are having a lot of gap between the dinner and the breakfast. Very simple. That is what is called as intermittent. But after that, don't eat chicken biryani all of a sudden as your breakfast, and don't spoil all the things what you have done for your colon. So don't go for that heavy brunch or something after all these rituals. So stuff it with good juices, and this happens. Why I said this joke is, in Dharmasthala, where my hospital, actually, the patient, they get admitted and they do a very good cleansing of 40 to 45 days of grape juice fasting, and they reduce around 10 to 15 kilos and they will be very happy. But there is a shop near my hospital. So what happens is the smell of that masala dosha, they stimulate them and they eat after that 41 days of fasting and they spoil it all at that one single minute. So don't do that in your life, because that makes a lot of mess in your system. It is spicy. So it gives a lot of spiciness inside, and again it worsens your situation. So I just made this story that tomorrow everyone will remember this story, maybe not my theory part. Okay, so you will always remember the stories. So keep in mind that the more food you are giving, throwing to your system, the more problem for your, especially those who are having genetic, what to say, hereditary with the cancer, you have to be very, very careful in the eating habits. So intermittent fasting is one of the best solution. And the second thing, if you can go for weekly 1 day fasting, it will be the best thing. And the second thing, don't eat night. And people who are working for the IT and people who likes to late sleeping, I have seen them, they eat a lot of chocolates. So go for dark chocolate instead of the other chocolate. You can swap the healthy and the unhealthy. Got it? If you like potatoes, you go for the sweet potato fries than the potato fries. So there are many, many healthy options. So you can go, instead of milk, you can go for the coconut milk, because most of the uterus disorders, there is one particular substance or hormone called, I think it's a substance called as casein in milk, that is very, very problematic for all the PCOD and PCOS. So this milk can be swapped with the coconut milk or an almond milk. So for all the teenage out here, you can go and swap the coconut milk instead of the cow's milk. And the next one, I already mentioned about the recreational activities. Exercise in moderate intensity, sweat 3 times in a week, go for walking in the fresh air, more of oxygen, and sleep on time, and reduce the stress by yoga, music or dance. So with this, I conclude my theory part, and let's get into our deep relaxation technique. I wish everyone can just lean on, can you just make it in a gallery view? Yeah, I will do it, yes. Yes. So can you just lie down on your back and you can close your eyes and relax yourself. We will just go to a deep relaxation. Those who are lying down on the floor, just legs apart, hands apart, head in any comfortable position. Relax your body and mind. Breathe in and breathe out deeply. Relax. Watch your whole body, how it is lying down on the mat. Close your eyes. Enjoy the music and the instructions. Start relaxing your feet, calf muscles, knee, thigh, hip. Relax it. Relax your stomach, chest, hands, fingers, back, shoulder, neck muscles. Relax it. Relax your back, middle back, lower back. Relax it to the floor. The last part is your face and your brain. Relax your facial muscles, eyes, nose, lips, forehead, head, chin, eyebrows, even the hair. Try to imagine and relax. Now, from your feet till your head, you have relaxed almost all the parts of your body. Now, it's time to cleanse your mind. Just imagine your mind as a white plate, and all the thoughts coming in your mind, just put as a black dot in the white plate. One thought, one black dot. Another thought, another black dot. You can see the black dots are increasing in the white plate. And the more you think about it, more the thoughts. Just watch your mind at the gate of your mind box and observe the thought, but don't go behind the thought. Just see what kind of a thought you are getting inside your mind now. Why this thought is coming right now. Keep watching. Now, just imagine you are taking a tissue paper and wiping all that black dot and making your white plate neat and tidy. Making your mind very beautiful and glow and shining. Inhale the positive energy to the inside. Exhale the negative out. Inhale the happiness and health coming all the way from the sky, getting in your body, spreading throughout. Exhale all the black toxins going away from your body to nowhere and making you very relaxed and calm and peaceful. Once again, take a deep breathing in and exhale and surrender to the Mother Earth and relax. Feel that empty space in you. Feel that you are floating or flying in the air. No more weight, lightness in your mind and in your physical status. This is the most beautiful space inside you. This is the most beautiful experience of your mind. Try to appreciate yourself, how beautiful I am. Tell yourself, I am very beautiful, I am very handsome, I am healthy, I am very positive, I am fearless, I am brave, I am confident. Keep on pouring the positive affirmations that makes you happy. And with this beautiful mindset, slowly come back to the awareness by moving your fingertips and toes. And slowly open your eyes and see the ceiling. And compare your body before the session and after the session. How am I now? And how I was before. And then slowly turn to any side, preferably left side. And come up. Do the palming. Produce the heat. Keep it above your eyes. Pass the heat and the positive energy to all the body parts. And keep it on your heart. Let me chant the Shanti Mantra for everyone, for the well-being of the whole universe, for the pandemic, for all the humans and plants and animals. Let us pray. Om Sarve Bhavantu Sukhinah Sarve Santu Niramaya Sarve Bhadrani Pashyantu Ma Kaschit Dukkha Bhar Bhave. Om Shanti Shanti Shanti. With this, I conclude my session. Hope it was beneficial for you. Over
Thank
to
you so much, Dr. Akhila. If possible, we would love to take some questions. If anyone has any questions they'd like to send in. Or you can turn on your mics and say as well. If you send them in via the chat, I will say them out loud. So we have from Zoom user, hello Dr. Akhila, I was wondering, for cancer patients, how soon after surgery is it safe to return to yoga, and what poses should they avoid?
They should avoid all the stretches which makes them uncomfortable. For example, which side they have done the cancer. It totally depends on that site of cancer. Okay, for example, if it is a breast cancer, they should avoid all the postures which is terribly stretching their upper body. And if it is for the stomach, they have to avoid all the postures that is squeezing and bending and turning and twisting. So, and it totally, again, I'm coming to this one because what stage are you in? Because it's a difficult question to answer because it's just a rough idea, it's a general question. But you have to ask your doctor that which stage that person is, and also like what is the what is the recommended dosage of or intensity of exercises prescribed to that particular patient. Thirdly, whether that patient, how old is he or she, that is very important. And the complications of the body after the chemotherapy, sometimes some people get very aggressive complications like lymphedema can be more, or there can be fluid retention more. So it totally depends upon the complication. So it's not a simple question to answer because it's a lot of things to explain in that. It totally needs your doctor's consent to go for that yoga exercises. Okay. Is there anything that you should do along with yoga, excluding that would help your mind and body? Of course, like whatever we mentioned in this stress and anxiety, right now you have got the proof. Other than yoga, what else is needed? This deep relaxation technique. You have to go and commit yourself to some yoga instructors, or any other passion of yours. For example, you are a lover of martial arts, you can go for that. Okay, other than diet is very important, but if you don't want to do the good dieting, then you have to go for some exercises that can burn all the calories.
We also have a question from Bishop who asks, how long would I need to do yoga and meditation to start seeing an effect?
Again, it's your mindset. So it differs from person to person. For example, I'm a lover of, or I accept yoga and meditation before I started yoga and meditation. So for me, how is your acceptance towards something? For example, you, Bishir, right? Bishir, he accept me or not for this webinar. Got it? If he doesn't like me, he will not agree with any of the points. Okay? But if he accept me, within a month he will change. Got it? So the first is the teacher whom you are getting the guidance from. The second one is totally depends upon his mindset towards that particular thing. If he is having a questioning mind and a confused mind, whether I will be able to do, then it will take maybe more than 2 years to get into that adaptation. But if you love something and you wanted to get into that, within 1 week you will be into that situation. But there is a monkey chattering in everyone's head. For that to, I think, generally when I see my clients, I think 2 to 3 months is the best time for everyone to get adapted to something, whatever it can be. Not only yoga, even if you go for a dance or any other forms, you minimum time duration to get into something is 3 months, I feel personally.
Thank you. And we have a couple more questions. Please, I apologize if I pronounce any names wrong. Nivedita asks, are there certain cancers for which yoga is more effective?
Breast cancer. That's why I was giving you more postures for the breast cancer. Certain cancer for which, yeah, more of this breast cancer. And also lung cancer is the most dangerous cancer out of all cancers, what I believe. And liver cancer is the fastest cancer. So lung cancer, you can go for all the breathing exercise what I have taught you, and also you remember the stretch we have done. This all can, that particular postures can really reduce the effect of that cancer to the cells. So it will not, I can say, it will not spread much if you are doing some blockages like yoga and meditation and breathing techniques. And you might have heard some miracle happening in cancer patients. Why? Because of their confidence level and also their trust in some system. So if you trust, I have many doctors like my own classmates, they have got a very good result, and even the other system, they have completely told them that you will live only for 1 more month, and they were actually that they are living longer than their own. Now they are 70s, okay, and they got a cancer in their 40s and they are living more than 20 years. So what can be the reason behind it? It is the confidence. The mind power is the one of the best thing you need for cancer. More than yoga, I go with the mind power. Okay.
Definitely agree. We have a question from Harriet. Are there certain times in the day that are better for meditation and yoga?
Yeah, sure. Sunset and sunrise. These are the 2 times which is appropriate for yoga, because when you get up early in the morning and you are in an empty stomach, this is the best time to do yoga. And also sunset time towards the end of the day, that makes you very positive. And then after the yoga, take 30 minutes. I will give you a good schedule also along with that, like a bonus. 30 minutes you go for, like after the yoga, for example 6 to 7. My clients are having 6 to 7 yoga. 7:30 you go for your dinner, and then 8:30 you go for a sleep and see the changes in your life.
Thank you, Dr. Akhila. We also have a question from Dr. Aparna. Should post-cancer treatment patients continue yoga for lifelong for better life quality?
Of course, they should do this. This is very important question, because the post-operative treatment or the rehabilitation, what we call it as, is very important. See, once they start doing the yoga and the breathing exercises, they feel that they are kind of rejuvenated. Okay, so I see most of the cancer patients, they come to some resorts, and after their chemotherapy or during their the side effects of chemotherapy will stay a little bit longer, isn't it? So during that phase, I have seen many patients getting admitted to the resorts and Ayurvedic treatment centers. Why? To forget about that bitter experiences, pain and all that, and to get rejuvenated through the diet. Because once they are back home, they will not be able to get that kind of strict regimen from their own family. So they get admitted to the Ayurvedic centers or resorts. Then after again they are back home, they must follow the diet and yoga through their entire life, not to get that again. So this is highly recommended as a preventive measure.
Thank you. We have another question from Harriet.
Okay.
How much time should you spend during meditation or yoga each day? Is there a limit in which you're doing too much?
Yeah, anything out of the limit is not good. But yoga actually, if you are doing, for example, the postures, for example, power yoga, if you do like more than 2 or 3 hours, it's not good for your body. Because just imagine a hairband. Okay, this is a hairband. So if I stretch and I it regain its position, it's good enough, right? I stretch, I pull it to the maximum, it loses its shape, isn't it? It is becoming worse. So this is the answer for that. Okay, anything out of the limit, it's not good for you. Everything do for 1 hour to 1 hour 30 minutes, that will do good for you.
Thank you so much, Dr. Akhila. Do we have any more questions from our audience? Okay, if not, if it's okay with Dr. Akhila, if there are any questions sent afterwards, I'll be sure to forward them to you.
Yeah.
Hopefully we can get a response.
Yeah.
Perfect. Thank you so much, Dr. Akhila, for a truly insightful take on how yoga's healing powers both before and during cancer. I believe I speak on behalf of everyone here when I say that we thoroughly enjoyed the yoga and meditation session. And thank you to the audience for attending this session. We hope that you were able to take some very helpful information away from this.